A presentation on public health and the community by Hannah Farwell. What happens when the flu or E. coli breaks out in a particular community? Who will take care of the communities affected by natural disasters, like tornadoes or earthquakes? Additionally, how is education on the importance of public health delivered, and what organizations will deliver it? All of these questions can be answered and are answered by public health. Various public health organizations, from the local and state levels up to federal and international levels, work to prevent disease, prepare communities for disaster, and heal when these diseases or disasters occur. Public health not only serves to handle community health concerns post-incidents, but also in the prevention of health concerns for communities and promotion of good health practices. The various organizations and processes put into place to aid in these endeavors by public health as an institution are undoubtedly and supremely important for population health. The role of public health in the community. Public health's role in communities is integral to population health. Its goal as an institution is to improve quality and quantity of life through assessment of population needs, education on prevention of disease, and promotion of general wellness. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of illness or infirmity. Although the current tools for examining health make it simpler to measure negative health outcomes, as opposed to assessing the spectrum of good health, this definition very nicely defines the comprehensive concept of health. It is ultimately the goal of public health to achieve the state of being as defined by the World Health Organization. Weaknesses of public health. I would like to now take a moment to point out one of the identified weaknesses in public health as it exists now, but this can also be viewed as an opportunity for growth and expansion of the public health system. Public health and primary care are often viewed and treated as separate entities. Much of the time, public health is not included in primary patient care, in many ways due to the methods public health employs: surveillance, epidemiology, and population-based communication strategies. The only places we might see public health overlap consistently at this time is in travel clinics, specialized clinics that handle sexual health and immunization. More significant cooperation between these two sectors of health could create a stronger healthcare system overall, in disease prevention, injury, and even for social problems in areas where primary care does not normally extend at great rates. One such example occurred in Switzerland. Public health officials and primary care physicians collaborated to gather epidemiological data not only on specific diseases, but also on the healthcare needs of their community. This partnership seems like it should be commonplace, since primary care physicians often have more personalized access and exposure to the specific needs of their patient population. One very significant way that our country has recently attempted to merge public and primary health is through the Affordable Care Act, put into place by President Obama, specifically the component of this law that affects the use of emergency rooms. Emergency rooms in their origin were created due to a public health concern in the 1960s and are therefore a product of public health need. When the interstate highway system was first established, the number of accidents and deaths related to automobiles greatly increased, and there was an immediate need for an emergency care setting to meet that specific care demand. By making affordable healthcare accessible to those who could not previously participate in coverage, the Affordable Care Act will seek to lessen the volume of non-acute care occurring in emergency rooms, the cost of which taxpayers must bear, and more individuals will be able to seek care and prevention services from their primary care physician, ultimately covered by their insurance plan. In general, improving the functioning of healthcare systems, the public health sector, and adding the value of primary care provided to the individual could allow for more resources to be made available to be spent on public health, including social determinants of health. Please note, while the Affordable Care Act does have many positives, one of the major concerns is that the last point is not actually true for this law as it exists now. Insurance companies, not the government, are experiencing revenue. There is a lack of government revenue being generated, revenue which could be used to help with the aforementioned public health and social determinants of health. Organizational structure of public health. Handler, Issel, and Turnock define the structure of the public health system in the United States as the cumulative resources and relationships needed to successfully follow the processes and achieve the goals set forth by the public health system. They suggest that the foundational blocks for this structure are information resources, organizational resources, physical resources, fiscal resources, and human resources. In 1979, the U.S. Department of Health and Human Services was born out of a move to combine the United States Department of Health, Education, and Welfare and the United States Public Health Service. As can be seen here, the organizational structure of the public health system begins at the top, with the Deputy Secretary, who acts as Chief of Staff for the U.S. Department of Health and Human Services. Organizations like the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry work collaboratively with the other listed organizations to address various public health concerns and threats. If the chart were to be expanded, state and local health departments and public health agencies would be included below. However, it is important to note that this chart structure does not reflect the order of action taken in the event of a public health emergency, whether it be environmental, biological, or infectious in nature. Reaction always starts on the local and state level first. These national organizations work first and foremost to train and prepare local health departments. On the next slide, we'll take a closer look at what one of the organizations in this structure does for these local and state agencies. The Centers for Disease Control and Prevention has unique knowledge of many types of public health disasters, and therefore does a great deal to aid and train local and state health departments. Under the Public Health Emergency Preparedness Cooperative, a source for funding of state, local, tribal, and territorial departments of health, over $9 billion has been given to these aforementioned agencies since 2002 to upgrade their effectiveness in public health emergencies. The CDC also provides annual training and guidance, including technical assistance, to help these agencies strategically plan and strengthen their response to disasters. This includes conducting exercises and meeting performance-based goals, all with the ultimate goal of making these agencies as effective as possible in the event of a public health emergency. Because public health reaction begins at a local and state level, organizations like the CDC or FEMA will move to aid these agencies if and when they become overwhelmed. Medical resources and materials, as well as personnel, will be deployed in addition to scientific and logistical expertise. Depending on the type of disaster, many of the organizations listed on the previous slide as a part of that chart model a very similar pattern of involvement with public health emergency prevention and reaction. Legal and ethical implications of the public health system. The legal and ethical dimensions of public health can be complex, as opinions will vary on the topic. A good example to examine surrounds immunization. This is a hot topic in our society today, as a new wave of parents are choosing to refrain from vaccinating their children due to concerns about possible side effects they may cause. While the country's public health stance states these claims are not valid and that refraining from vaccines has the potential to cause a major public health outbreak, questions about the real power our governments, local, state, and national, have to enforce the receipt of vaccines linger. Forcing individuals to immunize themselves and their families means we are disregarding their rights to choose not to be immunized. While we cannot infringe on the rights of the individual, the line here is somewhat grayed. While it is true in situations such as this one, that one might feel that a discussion of rights is solely ethical or moral, it is also true that such ethical issues are quite often enforced by law. In the public health sector specifically, this is done to promote the global good. We restrict certain behavior in order to promote good health. For example, we limit the drinking age because we know that drinking and driving occurs at a higher rate for those under the age of 21. Studies show that increasing the drinking age to 21 significantly lessens the number of automobile accidents related to alcohol consumption. There are already many laws in place that have ethical foundations and implications. Many of these laws have been reviewed by the Office of Government Ethics, or OGE, an agency put into place to ensure ethical standards are being met by the executive branch of the government. Although many of these laws are not health-related, there are a number that do address health concerns. For example, the Ethics and Patient Referral Act of 1989 ensures that physicians may not use pre-selected laboratories based on prior financial agreements. And the Health Insurance Portability and Accountability Act of 1996 increased the privacy requirements for verbal, written, and electronic medical records. Another ethical responsibility fundamental to public health is listening to a community's needs. Listening to the concerns of a community so those concerns can be addressed responsibly is vital to the public health system. Using science to educate and respond based on those concerns promotes overall health, including longevity of life and quality of life. For example, if a community complains of a high rate of automobile accidents in a certain part of town, public health officials can use scientific measures to study the area, including traffic volume, stoplight placement, etc. Using this data, they can determine if more stoplights need to be established, if traffic flow should be altered, or if speed limits should be decreased. To really promote that global good, we must listen to that community's concerns and feedback. To operate without listening to and addressing these concerns is not only to operate without an ethical or moral compass, but is to actually do public health efforts a disservice. Community residents often have better insight into their own needs as they are exposed to the good and bad of their community every day. Funding for public health. There are two models for funding public health in the United States, the market-based approach and the government-driven approach or public systems approach. The former allows for private funding of healthcare, and those individuals who are privately insured would fall into this category. A sort of supply and demand concept can be applied here. The consumer actually drives the healthcare system, but he or she will often be susceptible to copays, deductibles, and waiting periods for certain procedures. In the government-driven approach, funding comes from taxes, which are collected by the government for this reason. Programs included under this model are Medicare, Medicaid, and military health insurance. The Affordable Care Act is the newest development in healthcare, and the funding for this program will come from taxes collected from U.S. citizens and certain businesses or insurers that provide high-end insurance plans. The roles of communication in public health. Communication is a key aspect for public health. It is invaluable for reasons which will be discussed momentarily. But first, communication between individuals and organizations fosters group efforts and a sense of community. Because the public health system is for a global good, it is pertinent that communication between all necessary parties be present and consistent. Some specifics include communication between physicians and their patients, communication involved in researching and collecting health data from various communities, and communication involved with the public via public service announcements or health campaigns. All of these are not only important for the purpose of disease prevention, but also to best manage the reaction in a public health emergency. Whether the delivery method is radio and television, school activities, or marketing-based, health campaigns are specifically important as they are often one of the few ways information can be relayed calmly and honestly to the targeted audience, free of misconception or myth. To be most successful, health campaigns must target the appropriate audience, raise awareness of the selected health issue, and additionally convey information in such a way that it convinces the audience that the information included will help to better their lives. It has to hold relevance so that the audience feels it is in their best interest to listen and act. Overall, health campaigns will not achieve their goals without collaboration between state and local agencies, government bodies, and with the backing of legislation. So communication between all necessary parties is key for public health success. Collaboration, which includes a strong component of communication, is vital for maintaining a strong public health system.